31. Which feature on MI is useful in differentiating decided from modic type 1 and plate changes? High signal within this on T2W helps differentiate decided from modic type 1 and plate. Then type 1 is type 1 and plate high signal within this on T2W. Modic type 1 is the fluid-like signal, so T1 low, T2 high. 32. You are discussing osteoarthritis. Which is least likely to indicate progressive disease? Grade 1 osteophytosis in the knee joint. In osteoarthritis, grade 1 osteophytosis in the knee joint least likely to indicate progressive disease. 33. Which measures can be used to decrease the majority, especially artifact from the joint processes? To use of fast spin echo, images rather than gradient echo sequence help decrease magnetic susceptibility artifact. Fast spin echo rather than gradient echo helps decrease magnetic susceptibility artifact. 34. HIV positive with knee and ankle pain and swelling results after 4 weeks, most diagnosed HIV-associated arthritis. HIV positive and then knee and ankle pain, and results after 4 weeks, so diagnosed HIV-associated arthritis. 35. Falling on an outstretched hand, posterior decay of the capillary layer with the lunate, most common associated factor with injury scaphoid. Falling of outstretched hand and then there is posterior decay on the capitate, so it is commonly associated injury with this scaphoid. 36. History of pulmonary sarcoidosis. Which finding on plain radiograph of the hand is atypical of gallus sarcoidosis, joint split narrowing. Joint split narrowing is not seen in gallus sarcoidosis. It is atypical. 37. History of episodic swollen red joints. Hand X-rays of bilateral symmetrical disease affecting the distal and proximal interpingment joint. In the affected distal interpingment joint, there are central erosion, atherosclerosis, and margin osteophytes. Now, episodic swollen red joints. So this is seen in gout or pseudogout, and pseudogout other name is CPPD, so calcium pyrophosphate disease. Correct? So this is pseudogout. Episodic swollen red joint is either gout or pseudogout. And then gout involves the big toe and pseudogout involves other joints. So then all these features are seen in calcium pyrophosphate arthropathy. Look, in affected distal interpingment joint, the central erosion, atherosclerosis, and margin osteophytes. First cartilage joint in the left hand shows loss of joint space with osteophyte formation. The scaphoid trapezium joint in the right hand also shows loss of joint space and atherosclerosis. In the left hip, there is non-uniform loss of joint space with associated subcondylar formation, with main differential calcium pyrophosphate deficient arthropathy. 38. Swelling in the upper lateral aspect of the right calf, or numbness in the dorsum of the right foot, well defined. Thin, so swollen in the lateral aspect of the right calf and then numbness. So this is most likely a neural disease, ganglion cyst. Numbness on dorsum of the right foot, well defined thinly separated cystic lesion intermittently inlaid to the proximal tibiofibular joint and extending into the adjacent soft tissues. Society diagnosis, ganglion cyst. Other don't make any sense. 39. Back ache and morning stiffness, uveitis in upper zone and disparity fine capitation on the auscultation. Most correct in relation the neurological feature of the underlying condition. Ankylosing spondylitis involves the vertebral edges or center. So these are features of ankylosing spondylitis. Ankylosing spondylitis involves which vertebral edges or the center. 40. Radiofrequency ablation. If the following is true, complete symptom relief is seen in 90% of initial therapy. Question number 41. Sclerosis at the patellar tendon attachment to the inferior pole of the patella. MI shows edema at the patellar attachment of the patellar tendon. Most likely diagnosis, Sinding-Larsen-Johnson syndrome. Necrosis at the inferior part of the patella. 42. Which MI period would be most typically associated with osteomyelitis rather than acute neuropathic arthropathy? Focal involvement. In osteomyelitis, there is focal involvement. 43. Successor expansile loosened lesion arising from the lateral aspect of the left 7th rib. MI shows obliterated involved multiseparated lesion with fluid level. The dependent layer of which are hyperdense on T1, most likely diagnosed adrenal bone cyst. This expansile loosened lesion, and then with multiseparated lesion, so diagnosis is adrenal bone cyst. It's expansile. 44. Incidental reabsorption is of the middle portion of the distal phalanges is demonstrated. Most likely underlying cause is polyvinyl chloride. Incidental resorption of the middle portion of the distal phalanges is demonstrated. Most likely underlying cause is polyvinyl chloride. 45. So rare cup tier, what is the advantage of using a fat plus T1 sequences? Differentiating particle from full thickness tier. In our rare cup tier, why do we use fat surplus images? To differentiate particle from full thickness tier. 46. Small lump in foot. Ammonite to small soft tissue mass bears homogeneous growth signal on T1 and T2. The mass enhances the carolina, most likely diagnosed plantar fibromatosis. On a small lump in foot, ammonite to a small soft tissue mass which has homogeneous growth signal on T1 and T2. So T1 and T2 low is fiber, so plantar fibromatosis. 47. Fast history of hypothyroidism regarding CPP disease, transit for spared deficiency pollen disease. Which of the following treatment is the most appropriate? The presence of hypothyroidism is associated with this diagnosis. The hypothyroidism is associated with CPP disease, calcium pyrophosphate. CPP disease is associated with 4 H's: hemochromatosis, hypothyroidism, 47. Disorders associated with CPP disease are the 4 H's: hyperparathyroidism, hemochromatosis, hypothyroidism, and hypomagnesemia. Hyperparathyroidism, hemochromatosis, hypothyroidism, and hypomagnesemia. So here we have hypothyroidism. Presence of hypothyroidism is associated with diagnosis of CPP disease.